Hello. So we would like to know more about torticollis.
Okay, what would you like to know?
Can you tell me like what causes it and what it is?
Yeah, absolutely. So, torticollis is when babies have a stiff neck muscle. So, the sternocleidomastoid muscle, this ropey muscle in the front of the neck, can get stiff for a variety of reasons, including just their positioning in the womb. If they were kind of tight in there and had their head to one side, or possibly after birth, if for some reason they were positioned in a way that they only turned their head to one side or had only interesting things over on one side, they might have developed it after birth. But basically, it's when a baby prefers to turn their head in one direction more so than the other direction as a result of a tight muscle.
Okay. So what should I do if I notice my baby turning their head in only one direction, like you were talking about?
Yeah, so if you are noticing a difference side to side in their range of motion, you want to reach out to your pediatrician and let them know what you're seeing. And they'll likely want to refer you to physical therapy where you can get an in-depth evaluation and some stuff to do. In the meantime, while you're waiting for physical therapy, you can make sure that you are attracting your baby's attention in the opposite direction. So try to position any hanging toys that you have on the side that they don't want to turn to, have them sleeping in their bassinet to where they need to turn the opposite direction to look at you in your bed while you're sleeping, or if they're in their crib, have them positioned so that the wall is on the side that they prefer to look to, so that they have to turn their head the other way to look at anything interesting. And then once you get into PT, we'll give you some more tools.
Okay. So with my baby only looking one way, is there like a risk for, I've heard others tell me about kind of like a flat spot on their head. Have you heard about that?
Great question. Yeah. So if they are only looking one direction, then they can get a flat spot on that side of their head, and that's called plagiocephaly. And so if you're noticing that, then that is a reason to get into PT right away so that we can definitely start to get them looking the other way. And then also, if you're noticing plagiocephaly, just trying to keep your baby off of their back as much as possible. So obviously they need to be on their back to sleep at night, but if you can during the day, have them on their tummy as much as you can, holding them, having them in the carrier as much as you possibly can to keep pressure off of the head.
Okay. So now that I've got the referral for physical therapy, what does an appointment look like?
Yeah, great question. So your initial evaluation for PT is going to look like the PT is going to look at how far your baby can turn their head in both directions. They'll look at how the rest of their body moves, so their trunk mobility, their shoulders, and their hips, because all of those parts of the body can affect how they want to be positioned and turn their head. So they'll make sure that we don't have any limitations in range of motion anywhere else. And then they'll also test your baby's development. So just see how well your baby is moving and doing what they should be doing at that age, as well as check their head shape to see if there is any of that plagiocephaly. And then they'll give you some tools. So some home exercises that you can do in order to improve the range of motion, show you some stretching, and some strengthening activities.
Awesome. That sounds great. Thank you.
Yeah.